Yes.
Okay, perfect. Well, good afternoon. I'm Dr. Jessica Ledbetter, and I'm the Assistant Dean of Students at UTA. I've been in my position for about a year now. We've had a number of changes in the Dean of Students office that hopefully we can help provide that information to you today that would be useful, so you know what resources and support we can provide to you as well as to your students. I'm going to go ahead and kind of go through a few things here for you. As you can see on the screen, this is our mission statement for our office. This is a fairly new mission statement. And part of the reason we have a new mission statement is the office has gone through quite a bit of restructuring over the last, I would say, 6 to 8 months. So previously, you're probably all familiar with the fact that UTA had an Office of Community Standards, and that really sat underneath the Office of the Dean of Students. And to try to help clarify the structure there, it is now called, well, it's not really community standards. It's a subunit of the Office of the Dean of Students. But we don't only do conduct work, and that's always been a bit confusing. We also have another two teams. So we have a community standards team that helps out with our conduct concerns. And then on the other side of the office, we have the student outreach and support team. So let me talk a little bit about kind of both sides, and then each of those areas are going to actually address you directly so that you can hear a little bit about what they do. So we talk about community standards, we talk about conduct. Obviously, I think most of you understand generally what that is, but just so you have a little bit of clarification, they handle all kinds of conduct. So the things that are probably most applicable to faculty, really talking about academic misconduct. That's a good majority of the work that happens in our office, and Tony's going to talk a little bit about that. But it's general conduct too, so you can assume the typical college student behavior like alcohol misconduct. Honestly, we have things like fights that break out between students. We deal with organizational conduct. We actually have a staff member in our office who oversees residential conduct. So doesn't necessarily actually adjudicate all of those cases, but helps work with our residence directors that help adjudicate those cases that happen within our residential spaces and apartments. So there's a number of things that our conduct staff work on. On the student outreach and support side, we have kind of two big areas that they work in. So Dr. Adrienne Mead, who's going to address you shortly, is actually going to talk a little bit about the compassionate medical withdrawal process. And there's actually quite a bit to share there because there's some big changes coming, and she's going to help you understand what that looks like. And then the other two staff members that you can see on the screen, Taylor Faulkner and Bailey Garcia, really help with primarily our care team. So Taylor Faulkner is our care team case manager. So if you've ever submitted a care team referral, it really goes to these two ladies who help triage to determine what those students' needs are, determine how significant those needs are, really on a scale that we utilize, and then work with our care team that are members from across campus to ensure that those students are appropriately supported. And Taylor's going to tell you a little bit more about what that looks like. So I'm going to go ahead and turn it over to Tony, who is going to start talking about community standards.
Everyone, my name is Tony Minter. I'm the Associate Director for Community Standards. Our basic role in our office is to enforce, educate, and also engage. So we are enforcing the university policies. We're also educating students about their rights and responsibilities and holding them accountable for their actions. And then we're also engaging our students. So throughout the semester and throughout the year, we plan programs, and we also have presentations and discussions with students in regards to expectations of what it means to be a Maverick here on campus. We follow the policy that is written in our handbook of operating procedures. You can find it on that website located right there, along with the sexual misconduct policy and our housing and residence life policies. Next slide. So as far as education, we are a resource for our students, help them just to resolve any of their issues, just to help them just be successful while they're a student here at UTA. We also provide trainings. Our students this past year, all of our UTA students participated in our prevention education compliance training. And so with that training, you may have heard any of them mention they had to take some hazing trainings, as well. There has been there's a comment that they can't see the slides. I want to make sure.
Let me try stopping and resharing. Let's see here.
No problem. I didn't want to continue on if they can't see the slides.
Can you confirm if you can see them now?
Oh, all right.
All right, perfect. Thank you.
All right. Thank you all. So I'll continue on. So as far as education, we also provide trainings. So as I said before, our prevention and education compliance training, all UTA students participated in for hazing prevention. And then for our first year students, they participated in hazing prevention, alcohol, and also sexual assault prevention. And then as far as outreach, we have had popcorn and pledges where students are pledging to abide by the and uphold our UTA honor code. We've had integrity days that occurred just this past month, just in the beginning of October. We also do hazing prevention outreach. We have a committee here at UTA that even though it is housed in our office, it is a collection of campus partners, including some faculty members. If you all are interested in helping out with that hazing prevention committee, where we plan events and just educate our university about hazing prevention. And then you'll also find us at a couple of other campus tabling events or any requested presentations from our faculty members. We are definitely be able to do that. As far as our bystander intervention training with Green Dot, that is also housed in our office, but it is again another collaboration with our campus partners for student education. As Dr. Ledbetter had talked about, the type of cases that are reported to our office are academic misconduct, general misconduct, some housing and residence life violations for our students that do live here on campus, student org violations, as well as Title IX cases. So those are typically what are reported to our office. But as far as faculty are concerned, we more than likely will hear academic misconduct cases. The three types currently for our policy that consist of academic misconduct is cheating, plagiarism, and collusion. And just a FYI for our faculty members, if you ever have suspect generative AI usage when it is not allowed in your classroom, that will be considered cheating, which means that any act designed to give an unfair advantage. Now, as far as reporting academic misconduct, our faculty members, we have this wonderful information for you all. You know, we first want to make sure that you all gather all your necessary information, documentation, and evidence. We encourage you all to speak to the student involved. This provides them the opportunity to reply back to you all, to provide you additional information. You can also ask follow-up questions, get more details in regards to the allegations to which, the violations to which you suspect has been the student engaged in. And then at the very least, if you cannot meet with the student physically, we definitely ask that you will email the student and notify them of the suspected violation, because we don't want our office to be the first time they are told of an incident or an alleged violation occurred. Once you have gathered all your information, you can complete a referral to our office. You would include all the relevant information. That includes the syllabus, any communication, and then also you will select the grade penalty for the student if they are found responsible for the violation. When putting in the report, we definitely ask that you use facts and facts only, as much as we understand that students violate our policy and you may have some personal feelings against that violation. We want to make sure that you keep the facts and keep facts only, just because our students also receive a copy of the report. Now, for our faculty members, you would give them an I letter grade, which is an incomplete until our process has been concluded. Our professors will get an outcome letter. They will be included in the outcome letter that we send to the student that has our decision on the case. Now, we also have another part of our process that's called a faculty disposition. What this is you get a copy of the referral that you send to our office. Should the student take responsibility with you either during the meeting or at any point in time, they can sign the referral and that is sent to our office. By signing the referral, the student is accepting responsibility and also accepting the grade penalty to which you would want to render that's applicable applicable. So once the student signs the faculty disposition, you could just email that to our office and you can give the grade penalty without waiting for our process to conclude. And this is just a rundown of how our process, what happens on our end of the process. So we receive the report of the potential misconduct. We will review the information, schedule a meeting with the student. During the meeting, we'll discuss the alleged incident with the student. The student has the opportunity to present any relevant information they have, should they accept or deny responsibility. And then we will send an outcome letter once our meeting concludes. If need be, we may contact the professor again just to get some additional information, or in case any of the information the student provides us is conflicting with the information we received in the referral. So sometimes we may need to get some just clarification. So that's when we'll contact the professor again, but that is only at the discretion of the conduct officer should they need additional information. But an outcome letter is then emailed to the student that has our decision, as well as actions or sanctions if we find the student responsible. And then how we work with the faculty members, definitely we provide as much support as possible. So if you all have any concerns or questions or need clarifying or need to know how and when to refer a student, you can definitely contact conduct@uta.edu, or you can contact me personally at tony.mentor@uta.edu, and we can set up a meeting or just talk if you have some time. Also, we will definitely present to classrooms at request. So that is a wonderful collaboration between our office as well as our faculty members. And so now that I am concluding my session, I'm going to give it over to our care team that will talk more about the other side of the house.
Good afternoon, everyone. My name is Taylor Faulkner. I'm the care team case manager in the Office of the Dean of Students. So I will be presenting to you all a little bit more about our team and what we do. So CARE stands for Community Advocacy, Response, and Engagement Team. It is chaired by myself and Dr. Ledbetter. So the CARE team is a multidisciplinary group of staff members across campus. And so we have different departments that have their special skills and things to help us best see how we can support the students moving forward. So some of the following departments include community standards, university police, including crime victim services, counseling and psychological services, division of student success, housing and residence life, Title IX and discrimination complaints, relationship violence and sexual assault prevention, or RVSP, Office of International Education, Dean of Students case managers such as Dr. Mead, Student Access and Resource Center, also known as the SAR Center, and then the Basic Needs Coordinator, who is responsible for anything with Emergency Assistance Fund, the Maverick Pantry, and emergency housing. So our mission is being able to help empower students during their time of need. Sometimes students may not know who to turn to, and faculty and staff tend to be the first ones to notice when a student is in distress. So our job is being able to connect students to on or off campus resources that help them achieve the goals that they're wanting. Also being able to promote the health, safety, and well-being, not only of the students, but faculty, staff, and the UTA community. Our purpose is being kind of that central resource hub, not only for students, but being able to connect faculty and staff to community resources or on-campus resources as well, so they know how to best help students as well. And then also the collaborative piece. So in our office, as well as with our care team members, we work together to see how to best support the student. So some of our on-campus partners are resources that we work closely with. So some of them are on our care team. So again, relationship violence and sexual assault prevention program, counseling and psychological services, the SAR Center, military and veteran services, Office of Talent, Culture and Engagement, involvement and engagement, health services and health promotions, Title IX and discrimination complaints, crime victim services, the Office of International Education, and the Maverick Pantry. So here on this QR code, it will take you to our online referral form. So if you guys have a moment, I know that we're all virtual. If you don't mind taking a picture, this is the best way to send a referral over to our office to let us know that a student is in need of something. So this can be Homesickness, noticing a student, their appearance being different, them not showing up to class. Maybe a student tells you that they witnessed something that's super traumatic. Anything with mental health, right? We have different types of things for the referral. So if you're not sure whether to refer someone on our team, that referral form will let you decide. We do like to reiterate, in case of immediate danger or suicidal behavior, to contact UPD or 911 immediately. They're more trained to be able to assess and evaluate a situation to determine what's the next steps for the students, right? At the end of the day, if a student is displaying these types of behaviors, we want to ensure that they're safe and being seen as soon as possible. After ensuring that the student is safe, we do ask that you complete that care team referral form, so that way we can begin the follow-up and intervening to take care of the student and see how we can support. Anyone, regardless of UTA affiliation, can submit a referral form. So a student's siblings, cousin, parents, a family friend, faculty and staff, anyone can submit it. We do also accept anonymous referrals. However, we do encourage just including your information just in case there's something that we need to follow up on or need some clarity on, we can get back in touch with you. And then referrals are regularly monitored to ensure timely attention to urgent concerns. So myself, Bailey, and Dr. Ledbetter are tending to look at the referrals as we get them. So if there is something that is of immediate danger or something that needs to take place as soon as possible, we do ask that you contact authorities as we're monitoring them, but not keeping our eyes off them at all times. And now I'll pass it over to Dr. Mead.
Hello, everyone. I will be going over kind of two things in one. I'm going to go over our current medical compassion withdrawal policy, but towards the end, once I wrap up the current process that we're under right now, I want to do a soft introduction to the process that we hopefully will be implementing. It's still in progress with the HOP committee, and we're waiting for final approvals. But I wanted to kind of do a soft introduction to the new policy and things and some key things that will be in effect come January 2026. So the Office of the Dean of Students, we evaluate, or I evaluate, students' concerns or circumstances that occur after the drop date. They have the option to submit a request only after drop date. So their hardship, unforeseen circumstance, emergent issue has to occur after the drop date of the semester. And I know that can be a little different for some majors like nursing and maybe sometimes social work, depending on when their classes start. But the current process and the current policy that we're under now, that is a full semester withdrawal, meaning that we cannot grant partial withdrawals, meaning if a student submits a medical compassion withdrawal, as the policy states right now, that is a full semester withdrawal. They have to submit that documentation that supports the request, meaning any kind of doctor's notes or anything that plainly outlines the student's hardship or emergent circumstance that took place. Typically, like I stated before, if they submit before the drop date, it's going to be denied. So that, in a nutshell, is our current process. There are going to be a lot of changes coming to our new process. So with the new medical compassion withdrawal and selective course load reduction policy, this will give us a clearer procedure for supporting students experiencing those unforeseen or medical or personal crises that impact their semester. Under the new policy, both the MCW and the selective course load reduction, that will be overseen by our office. Prior to that, it will be called the late withdrawal, which would go to the prospective colleges. That won't be in place anymore. It's kind of like a one-stop shop where if a student wants to do a selective course withdrawal, selective course load reduction, they have the option to do that under one process. So that's one area that will be improved. As far as retroactive requests, that'll be considered case by case, but with this new policy, they can only go one semester back. So we're going to use the example of fall 25. If a student wants to withdraw from fall 2025, they have the last day of spring 2026 to submit a request for that. That's as far as they're going to go back. Under the new policy, it will be the prayer that they only get granted one. Now, there will be circumstances that we will overview, and see maybe there's some special accommodations can be for that situation, but that'll be a case-by-case situation. With the selective course load reduction, that will be reviewed by individuals that will be designated individuals in the college, in each college, that will help us make those decisions. Once it's reviewed by the committee, which that committee consists of myself, someone from health services, CAPS, financial aid, in the Office of International Education. All those are key players. Once we get that application, whether that's for NCW, a selective course load reduction, we will review that. But if it's for a selective course load reduction, that information will be shared with those designees from each college. They will share their input on the outcome of their students' requests. They'll share that with us, and then from there, a decision will be made. I think I covered a lot of the information. If I missed anything, Dr. Ledbetter, please fill in for me, please.
So I'm just going to fill in a little bit. Thanks, Adrienne, for covering that. This new policy that we are in the process of moving forward with, I can confirm that it is currently with the HOP committee, and so far there have been no concerns. The goal with this is really to try to streamline the process. As Adrienne, Tony, and Taylor can attest, one of the things that I kind of see as my role as the Assistant Dean of Students is to try to streamline processes to make things more clear for students, so they're not jumping through a million hoops or getting rerouted to different people. And I do see that frequently. And this is one process that's been keenly part of that confusion on the part of students. And it's because we have Dr. Mead, who's doing an amazing job of reviewing these full course full course withdrawals. But then there's the confusion of, if a student only wants to leave 1 or 2 classes, but not all of them, they're currently having to use the late withdrawal exception form. And the challenge with that is that form requires quite a bit of legwork on the part of a student who is dealing with usually some pretty significant circumstances, having to go to their advisor, their faculty member, the dean, etc. The challenge too is there are different people looking at those documents than are currently looking at the full withdrawals. And it's still got to be the same decision-making process in terms of ensuring consistency. So the goal with this new policy is to bring everything into one consistent place where everybody is viewed in the same way. We use the same criteria, and it's all under the same policy. In addition, the late withdrawal exception form has been in place for a number of years. However, it's actually not part of the Handbook of Operating Procedures, and it's really not listed anywhere as an official policy of UTA. So we're really trying to get this to be in a much more streamlined but also legitimate fashion. It'll also be included now in the catalog, which will give students better notice that this is what the process looks like. Dr. Mead and our student case coordinator, who's not with us today, Bailey Garcia, have been doing a great job making the rounds. In fact, they've already presented twice today on this new policy. Bailey and I actually did a presentation to student government earlier this week. We've met with the associate deans, and so far we've gotten nothing but rave reviews and praise about trying to make this simpler. The biggest, I think, benefit for the academic side of the house and for academic affairs and faculty is you're not going to have students trying to hunt you down to fill out this form anymore. Instead, it'll be taken care of through our office. And then we still have the opportunity to have academic affairs involved, as Dr. Mead was saying, by having somebody designated from each of the selective colleges to be able to review those reductions that are just 1 or 2, but not all of the classes. And the reason it's set up this way is we fully understand that when a student withdraws from just a couple of classes and not all of them, that can impact degree progression in a different way than actually taking a semester off, especially if they're in a cohort model, and some degrees just require additional assessment. Obviously, Dr. Mead, myself, we can't possibly know all of those requirements and every single degree at UTA, which is why we're going to have these designated individuals. I've been working with the deans of your colleges, and we already already have those people designated. In addition, one thing that's important to note is currently in the current process that we're under, there's no formal appeal. It's not part of the policy. So the new policy actually creates an appeal process for the student. So let's say that the committee that Dr. Mead was describing denies their application to be able to withdraw fully. They actually can submit an appeal, and that appeal then is actually reviewed by somebody totally outside the line of decision making. The challenge is right now, the only person who reviews an appeal, which doesn't really exist, is me. And that really doesn't, it doesn't comport with good due process standards. So we're going to be shifting that to an actual formalized process. When we talk about those selective course load reductions, or just withdrawing from 1, 2, but not all classes, those appeals are actually going to go to somebody in the provost's office. So again, keeping that in academic affairs to make sure that there is an adequate review to ensure that the student isn't penalized or it's not problematic for the given college or school, and based on the degree plan that's insinuated. So just to let you, we wanted to preview that for you today. There'll be more information coming. I don't anticipate any roadblocks to getting this in place in January based on how things are moving forward at this point. Our legal team has already reviewed, and they fully are on board with what we're doing. And again, the goal is to streamline this for our students. We really want to make sure that they understand that there's one place that they need to come to, one form that they need to complete, and that will help move them forward. Again, thinking about student support, that's really important when you have a student who's dealing with a car accident, a parent with cancer. I mean, God only knows the kind of things that they deal with that Dr. Mead sees. It's quite a variety. The last thing I mentioned to you too that's really important about this is that now, she said, students only have 1 semester in advance that they can really apply for this. So as she suggested, if they want to apply for fall 2025, their last day to apply to withdraw from fall 2025 will be the last day of classes spring 2026. This is super important because of documentation concerns. We actually just got an application last week for a student who wanted to withdraw from a semester in 1993. You can understand why that would be challenging. One, I don't think that this current policy was even in place, but 2, we wouldn't have any way to be able to verify if that documentation is accurate. So we really want to make sure that what we have is the most current information. This also pushes students to be self-responsible, right? They need to take care of their business as it's occurring and not wait, which I think makes it more predictable for academic affairs as well as their actual academic journey. So I think that's a big benefit. And she mentioned that this is a one-time exception that we would allow them to withdraw. Obviously, if a student had cancer and then had a car accident, we may consider that twice because it isn't related to the same thing. But we want to prevent students continuing to use this as a mechanism of withdrawing from classes repeatedly for something that has been long-term ongoing that they already had notice of. In those cases, again, pushing for student responsibility and self-promotion, they should be withdrawing or never enrolling in classes if they're not capable of keeping themselves safe, keeping themselves healthy, and staying in their classes. So all of that is kind of wrapped into what we're doing with this new policy, and you will be hearing more about it. In fact, we'll probably be putting some languaging out in MavWire. You'll probably hear from Dr. Banda a little bit more information about it as we move forward, but that's what's coming here very soon. So with that said, I'm going to go ahead and stop the screen share. Were you going to say something else? Go ahead.
Yes, I had one more thing, and this question came up in our last presentation just about an hour or so ago. One of the advisors asked if students would, since it's we're giving students one opportunity to do this, will students pretty much get a clean slate and start over again? And the answer to that is no. If they've received one in the past, that's their one. Unfortunately, they're not going to be kind of like a redo or restart for students that have submitted in the past and they have been approved, for them to get their one time again under this new policy. That's for us to kind of safeguard what we're doing and where we're moving to. And that came up as a question in our last presentation just about some time ago. Just wanted to make sure I put that out there.
Yeah, that's great. Thank you. So that was what we wanted to cover today, just a little high-level overview of our office. I'll suggest, And I think we had the next slide, but it doesn't really matter. If you want information, or you would like a presentation, or you want to go in depth on something else, we are always happy to come share at department level meetings, college level meetings. We can come and present to your classes, whatever is most beneficial for you. Something that is really a strategic goal of the Dean of Students office is to eliminate the black box that I think a lot of faculty think our office is, and not understanding what happens. If we can try to help with that transparency as much as possible, we'd like to do that. If you wonder what happens on a day-to-day basis, I'm happy to share what our office looks like. I can also share a little bit about how many cases we typically see, which I can tell you right now have been tremendously on the increase, both on the conduct side and on the student outreach and support side. This is a very busy time of year for us. We kind of have high seasons, and this is definitely one of those high seasons. I can also share with you what some of the big areas of concern that are coming to our office, both conduct and student outreach and support. So if you ever have questions, you want us to come and present, we are more than happy to do so. One thing I'll say as we're kind of closing out is, again, we are always available to answer questions. I get random questions from faculty members all the time, and we are always willing to answer any question that you might have related to conduct, how to support students, resources on campus. We're currently working on trying to create our own internal guide for external resources, so off campus. So we'll even be able to hopefully start referring students off campus if we don't have those things here right on UTA's campus. We're creating a network of partners externally in the DFW area to help build that out as well. So if you would like us to come present to a class, to a department chair meeting or department meeting, a college meeting, please just let us know. You can reach out to me individually or any of the staff members that are on this session. But we really appreciate y'all joining today.